Hello YouTube, this video is for those who are looking for an idea on how to do this assessment or taking classes at Capella University. This is assessment number 2, policy proposal for the class NHS-FPX6004. The name of the class is Healthcare Law and Policy. I took this class as part of my master's curriculum in neuroinformatics. I hope you'll find it helpful. This is a title page. As you can see, it is formatted according to the APA 7th edition requirements. Please feel free to look and mimic this. Policy proposal. Based on the underperformance established in the Mercy Medical Center benchmark evaluation dashboard in the metric area, there is a need to create and enforce a policy to address the quality of health. With this policy proposal and practice guidelines in place regarding the hemoglobin A1C exam, low and reduced patient turnout for eye and food exams will be addressed by encouraging a team approach within the organization. Policy change is regarded as the nation's health promotion strategy. A policy is one of the voices of change. It can be employed to create awareness among all of the stakeholders to make a difference that will foster changes regarding the quality and safety of care. Explanation of the need for policy and practice guidelines. Analyzing the Villa Health benchmark dashboard makes it possible to single out an underperformance benchmark. These are some areas or aspects based on the patient records. For example, there is a significant decrease in food patients visiting the facility for examination, 60 in Q1 and 42 in Q3 for 2019, Villa Health, no date. Also, a more statistically significant and easily interpretable trend is the decline of the patients visiting the outpatient department for the hemoglobin A1C examinations from Q1 with 60 in Q4 with 42 in 2019. Villa Health, no date. 2020, a slight reduction was observed from 72 in Q1 to 64 in Q4. The same year, eye exams were reduced from 50 in the first quarter to 42 in the fourth quarter. This is a benchmark underperformance because it fails to meet the National Healthcare Quality and Disparities Report (NHQR) set of the benchmark state. A continued and sustained pattern of rising patient volume through testing for hemoglobin A1C, eye and food exams benchmarked at an evaluated level of 6.8 every year. Villa Health, no date. This set benchmark they did not meet. The more an increased number of complications and more prevalence of diabetes will be recorded. It is therefore essential to have a clear and better understanding of prediabetes that will enable one to get a check early and hence get treated early. This may reduce or slow the rate of increase in the percentage of people with diabetes. One must understand that food exams and hemoglobin A1C exams are essential in prediabetes and diabetes complication assessments, and that is why one must develop a policy to enhance the number of these significant diabetes tests. The primary purpose of this process is to reduce and control critical leading the risks that contribute to ulcers and amputations. If the policy is not met, the prevalence of more severe cases of diabetes without examinations will be even higher. Proposed organizational policy and practice guidelines. The organizational policy to be proposed at Mercy Medical Center is the patient care policy. The procedure that can be used to operationalize this policy is by conducting training and awareness on diabetes tests among the community and the patients. This is important because it seeks to improve the uptake for eye exams, food exams, and hemoglobin A1C tests among persons. The factors that influence these practice guidelines include the total number of nurses in the facility, the total number of hospital facilities, the interaction between the personnel of different disciplines. Since nurses' primary responsibilities include patient care and education, this policy requires the correct number of nurses. Huber 2022. The number of facilities indeed significantly defines the number of patients in a hospital with a tendency to come in for examinations for diabetes. This means that awareness campaigns are one of the most essential commodities in creating awareness for those who have prediabetes condition or tendency to have diabetes. The CDC's National Diabetes Statistics Report in 2020 revealed that globally, about 13% had type 2 diabetes among adults over 18 years, while 34.5% had prediabetes. Therefore, this patient care policy proposal is directed to the interprofessional team leaders. The position entails the development of public awareness programs that can be employed to educate the public on the need to undergo screening for prediabetes. Analysis of potential environmental factors. Some external factors must be considered when designing the awareness program for prediabetes screening. These areas include staffing, financial planning, and support services. Staffing is an organizational factor that influences patient satisfaction in any healthcare facility. CDC 2022. Nurses also participate in patient teaching. Because quality care and better results are paramount, there is a need to ensure that the appropriate number of trained nursing staff is available to give the public training and awareness on the need to be tested for prediabetes. Huber 2022. By applying the framework, head nurses and other nurse managers are central to supporting and promoting an evidence base that will effectively foster the specified culture and environment. AHRQ, no date. Another aspect of resource consideration is the monetary aspect for the development of acceptable awareness programs that would be instrumental in preventing and managing diabetes. This policy requires that healthcare interprofessional teams collaborate to enhance the prevention and management of diabetes. Ethical evidence-based practice guidelines. The proposed policies include the eye, food, and hemoglobin A1C screening rate needs to be increased. Awareness of the need to undertake screening for diabetes among the populace. Increasing the number of nurses and physicians is a more appropriate and effective way of handling the issue. Educate patients on the need to undertake screening for diabetes, since this can assist in the diagnosis of prediabetes and complications due to diabetes. Huber 2022. Nurses should implement the campaign of increasing testing to diabetes in the general population. And after the food and hemoglobin A1C examination, the patients who are found to be having diabetes or prediabetes will be placed on early treatment. As proposed by the practice guideline, there is a significant change of practice, since nurses will now serve dual roles as patients' attendants and educators. As stated by the World Health Organization, WHO, improving community health outcomes requires nurses and services described by evidence-based practice. Davidson et al. 2021. Care coordination among the stakeholders of the healthcare delivery system is the best EBP strategy to facilitate the improvement of this performance benchmark by spreading awareness of how eye, food, and hemoglobin A1C screenings help evaluate prediabetes. AHRQ, no date. The stakeholders also participate in development awareness programs, endorsing, supervising, and appraising the strength of this program to meet the set intention and purpose. Involvement of stakeholders and groups. Nurses work most closely with patients, so when implementing the policy, the targeted group is nurses most of the time. Education of the patient is one of the significant tasks of nursing. Huber 2022. Therefore, nurses are directly involved in the powerful position of policymakers and actors responsible for decision-making and providing evidence-based practice to fortify organizational climate and culture. Nursing consists of the ability to adequately assess the results of the awareness program and its efficiency. Huber 2022 asserts that education on an interprofessional team is the essence and the first form of preparing the various professions for interprofessional practice in their future careers. Thus, the participation of all the above stakeholders is critical to the effectiveness of this policy's implementation. Strategies for collaboration with stakeholder groups. The more effective approach to cooperation is participation in implementing the policy that will now allow obtaining diabetes by constantly elevating the rates of patients who take the food, eye, and hemoglobin A1C examinations. There is a need to strive for bettering health functionalities in coordination. According to the study, Uber 2022, interprofessional collaboration is relevant in delivering quality and efficient healthcare. This is where most healthcare professionals practice their competencies in managing patient outcomes. Conclusion. In conclusion, based on the benchmark constructed at Mercy Medical Center, this policy proposal seeks to enhance patient reach for eye, food, and hemoglobin A1C screenings. This policy implies that the only way of expanding this number is by informing the public to help them understand that proper screening is essential for the prevention of the development of diabetes and the appropriate handling of any complications related to the disease. The policy requires all interprofessional teams and leaders to design, implement, and be held accountable for achieving a goal to enhance quality care and results. This is a reference page. It is also the last page of the paper. Thank you for watching, and I hope you now have a better idea about how this assessment should look like for a submission. Thank you all. Boris Gehrman. Bye.